There is an image of a vintage-style postage stamp on the right of this introductory slide. Inside the stamp border are 4 figures, a mother, father, and 2 children, representing a nuclear family.
Welcome to the Title X Program Requirements Training. This training will provide a concise review of the Title X program and an overview of the requirements applicable to all family planning staff.
The slide text reads, "The Title X Family Planning Program is the only federal program dedicated solely to the provision of family planning and related preventive health services." On the right side of the slide is a close-up image of a judge's gavel resting on a surface. Behind the gavel is a slightly out of focus, open book symbolizing law and public policy.
Title X of the Public Health Service Act was signed into law in 1970, recognizing family planning as basic health care. It remains the only federal program dedicated solely to providing individuals with comprehensive family planning and related preventive health services.
The slide text reads, "Title X expands access to care for low-income and uninsured people. Services offered include contraception, breast and cervical cancer screening, STI testing and treatment, and more." On the right is an image of a row of paper cutout figures of adults and children holding hands, forming a continuous chain across the image. The figures appear as warm brown silhouettes against a light background, with soft shadows cast below them.
Since its establishment, Title X has played a vital role in expanding access to care for low-income and uninsured individuals. Offering services such as contraception, breast and cervical cancer screenings, basic infertility counseling, and sexually transmitted infection testing and treatment.
The slide text reads, "The Title X Family Planning Program has served as a vital entry point into the health system for over 50 years. On the right side of the slide, a healthcare provider with a stethoscope stands beside a patient in an exam room. The provider holds a tablet and appears to be reviewing information with the patient who is seated on an exam table.
Title X-funded clinics have become a trusted source of care for millions, especially in rural and underserved communities. Today, Title X continues to be a cornerstone of preventive health care, serving as an entry point into the health system for many who might otherwise go without care. Its legacy reflects more than 50 years of advancing reproductive health access across the United States.
The slide text reads, "Title X, assisting individuals in determining the number and spacing of their children through the provision of acceptable, effective, affordable, voluntary family planning services." On the right side of the slide are images of the cover of the 2025 to 2030 Tennessee Maternal Health Strategic Plan and the 2024 to 2028 Tennessee Infant Health Strategic Plan.
Why is Title X important in Tennessee? Title X was created in response to the recognition that access to family planning is essential for improving public health, reducing unintended pregnancies, and supporting the economic stability of families. Family planning was identified as basic health care, and Congress affirmed that no woman should be denied access because of her income. Here in Tennessee, Title X services are offered through health departments in all 95 counties. The program provides individuals, both women and men, with affordable, effective, and voluntary family planning services. In short, it helps people decide the number and spacing of their children, supporting their reproductive life goals and helping them be at their healthiest before becoming pregnant. These services directly align with the priorities outlined in Tennessee's maternal and infant health strategic plans, making Title X a critical piece of our state's public health efforts.
This slide is titled Quality Family Planning. There are 3 images. The image on the left is the first page of the journal article providing quality family planning services in the United States. Recommendations of the U.S. Office of Population Affairs. Revised 2024, published in the American Journal of Preventive Medicine in November 2024. The image on the right is the cover page of the Providing Quality Family Planning Services. Recommendations of CDC and the U.S. Office of Population Affairs published the CDC's MMWR in April 2014. The image in the center is a preventive health services framework. There are three nested circles showing the relationship between family planning services, related preventive health services, and other preventive health services. The small dark circle lists core family planning services, which include contraceptive services, pregnancy testing and counseling, achieving pregnancy, basic infertility services, preconception health, and STI services. The medium-size white circle, which contains the small circle, includes related preventive health services, including breast and cervical cancer screenings. The largest circle encompasses the other two circles along with other preventive health services, like screening for lipid disorders.
In 2014, the CDC published practice guidance for the provision of quality family planning services, known as the QFP. This document established a framework for quality pre-pregnancy sexual and reproductive health care within the healthcare system. The QFP was updated in 2024. While maintaining the definition of quality, the revision places a stronger emphasis on patient-centeredness and individualized sexual and reproductive health care. It also expands upon the scope of services, incorporating new technical guidance and addressing a broader range of sexual and reproductive health needs. Notably, it shifts the conversation from assessing a reproductive life plan to exploring reproductive desires, underscoring the importance of tailoring care to the individual. Direct family planning services continue to remain central to the Title X program, including contraceptive care, pregnancy testing and counseling, assistance in achieving pregnancy, basic infertility services, and STD and HIV care. In contrast to the pregnancy-centered approach of the 2014 QFP recommendations, the 2024 update broadens recommendations for primary care screening and services to all individuals accessing sexual and reproductive health care, ultimately advancing the health of both individuals and communities.
The title of this slide is Eligibility. The text reads individuals able to cause or achieve pregnancy and no referral should be required. The image on the right is of a book page with the word eligible highlighted in pink.
Who is eligible for family planning services? Family planning services in Tennessee are available to legally eligible men and women who are of reproductive ability or capacity and desire family planning services, regardless of income or insurance status. The program is designed to reduce barriers and ensure that everyone can access essential reproductive health services. While services are open to all, priority is given to low-income individuals and those who are uninsured. Clinics use a sliding fee scale based on the federal poverty level, and many family planning patients receive services at low or no cost. Importantly, no one is denied care because of an inability to pay. Furthermore, access to family planning services must never depend on a referral from a physician or another healthcare provider. To ensure access to family planning, the Title X program has several service requirements. The first service requirement is that all family planning services must be provided on a voluntary basis. This means that, 1. Family planning services must not be a prerequisite to eligibility for, or receipt of, other services, assistance from, or participation in any other program offered. In other words, a person may not be required to use family planning services to receive, say for example, WIC or SNAP. Second, family planning patients should not be coerced to accept services, or coerced to use or not use a particular method of family planning. Finally, any personnel working with Title X funded projects may not coerce, or try to coerce, any person to undergo an abortion or sterilization. Doing so may subject said personnel to prosecution, a $1,000 fine, 1 year imprisonment or both. For best practice, all family planning clients should read, or have read to them, the consent form stating their understanding that receipt of services is voluntary, before signing. Confidentiality. Please follow institutional policies regarding HIPAA. Be mindful of potential breaches of confidentiality, like through insurance EOBs, lab reports, and pharmacy notifications. Title X also requires that services be provided in accordance with nationally recognized guidelines and standards of care, are client-centered, non-discriminatory, and trauma-informed. The QFP, mentioned earlier in the presentation, is considered the standard of care for family planning.
Training requirements. Trainings on the left are required once per grant cycle, while those on the right are required annually.
In addition to service requirements, Title X also has training requirements. The first training requirement is an overview of Title X and the service requirements, which were just covered. Additionally, trauma-informed care and patient-centered skills development training are required. These are required for all new employees working with the Family Planning Program, and once per grant cycle. Annual training requirements include mandatory reporting, human trafficking, and domestic and interpersonal violence. 2 trainings specific to adolescent patients seeking family planning services are also required.
On this final slide, there are blue and gray decorative elements in the top left and bottom right corners.
This concludes the Title X requirements training. Thank you for your attention. For questions, please reach out to the Family Planning team at familyplanning.health@tn.gov.